My name is Tathagata Das. I am an NHS consultant, um, having my NHS practice, as well as I work with Sheffield Oncology Group. Oncology is a very rapidly developing field of medicine, and I treat patients who are actually at one of the most vulnerable position in their lives, because we all know when patients are diagnosed with cancer, it's probably the worst thing anybody could expect for as far as a disease is concerned. Um, the thing which actually motivated me to become an oncologist, it allows me to help people who are um, at the worst point of their lives with a diagnosis of cancer. And it's not only the patient, the family members of the patients are also suffering at the same time. Um, Being a clinical oncologist, it actually allows me to treat patients both with systemic treatments like chemotherapy, immunotherapy, as well as biological agents, as well as I can treat these patients with radiotherapy. Also, being an oncologist, it allows me to use a lot of my soft skills, which I feel I'm quite good at. It's like uh, communicate with patients. You do need to show empathy and compassion to these patients. And also, as an oncologist, as a consultant, you have to be a leader. You have to guide your team. So you are playing within a team and you are trying your best to help the patient. So these are the reasons why I decided to become a clinical oncologist. When a patient has been diagnosed with cancer, actually, the patient as well as their family, they both are in an extremely difficult, extremely vulnerable situation. And when these patients and their family, they actually feel that I have managed to make a difference to their lives, or I have done something which has had a significant positive impact on their life, I think that is the most rewarding thing for me. I think my patients, they value my expertise. So I have been a consultant for 10 years. During this time, I have developed a lot of experience of dealing with um, lung cancers. And I feel my patients value that. And the other thing they value really quite a lot is the amount of time I spend directly as well as indirectly in managing their condition, managing, providing them care. These are the two most important aspects which I feel my patient value. My patients understanding that I'm trying my very best to help them, as well as their understanding that in spite of my best efforts, sometimes cancers cannot be cured. Uh, this aspect is quite important, and I value my patient understanding that. My mantra in my at work is always give you 100% so that I would never regret that I I did not give my 100% for every single patient. And the other thing is always be professional, but never lose your empathy or compassion for your patients.